Have you had ringing or buzzing in the ear that hasn't gone away? Have you had previous trauma or injury to the head, neck, or shoulder region? Does your tinnitus vary with your pain levels, posture, or activity levels? Does the pitch and volume change depending on your activity? Hi, I'm Liz, physiotherapist from MyPhysio2Go. We are here to help you manage your injuries and conditions for yourself at home. In this episode today, we will touch upon the muscular cause of tinnitus or ringing in the ear. There are different causes of tinnitus. If you already have had your inner ear and hearing check and have not been able to identify the cause of the ringing, try examining your neck musculature, more specifically the sternocleidomastoid and the masseter muscle. An active trigger point in the sternocleidomastoid can cause pain on the side of the head just behind the ear, around the eye, forehead, and cheekbone. It can also cause pain and ringing in the ear as well as dizziness or vertigo. An active trigger point in the deep portion of the masseter muscle can also cause pain and tinnitus in the ear. Let's do a self-examination. If you have ringing on the right ear, turn your head toward the left and bring the head slowly downward. Feel for the big tendinous muscle at the right side of the neck. This is the sternocleidomastoid. Take your thumb and two fingers and pinch firmly along the muscle belly, starting from the lower part of your collarbone. Slowly pinch and hold upward all the way near its attachment on your skull behind the earlobe. As you get closer to the earlobe, you may feel pain radiating in this pattern as well as your tinnitus worsening. To release this trigger point, gently squeeze the muscle at the areas where you feel radiating pain and hold for 30 seconds to a minute or until you feel the pain and/or tinnitus slowly subside. Work up and down the entire muscle. To examine for trigger points in the deep portion of the masseter muscle, find your cheekbone and follow the ridge toward the side of your head where your jaw joint or temporomandibular joint is. Find your TMJ by opening and closing your mouth, and you will feel movement at the joint. The deep portion of the muscle attaches just in front of this joint. Press firmly in this area and check to see if your tinnitus has intensified. To release this trigger point, hold the pressure in the area of the muscle where you feel the tinnitus and hold for about 30 seconds to a minute. Shift your fingers around and look for other sore areas and repeat. After you have released the trigger points, you should feel an immediate lightening of your tinnitus. To prevent these trigger points from reactivating, watch out for your activities and positions throughout the day. Positions such as poking out the chin, looking at a screen over to one side will tighten the sternocleidomastoid. Activities such as clenching the jaw, biting down on hard food, chewing gum, and biting your nails will tighten the masseter. The auditory nerve sends information collected from your inner ear to your spinal cord, then to your brain, where it is processed and heard as sound. Along this neural pathway, other inputs from the head and neck also get integrated, so stimulus from our sensory system such as touch, pain, pressure, position, and movement from the muscles, joints, skin, and other connective tissue in this area can affect and change our hearing. This leads to tinnitus, or more specifically, somatosensory tinnitus. So that's it. I hope this helped alleviate your stubborn tinnitus. Thanks for watching, and we'll see you next time.